Good afternoon, everyone. Once again, we are live at Sakra World Hospital, Bangalore. We have with us Dr. Lopamudra Pradhan, Associate Consultant, OBG, Infertility Specialist, to discuss all your queries on recurrent miscarriages. Doctor, welcome to the show.
Thank you.
Here are a few questions from our viewers. So, if we can proceed.
Yes.
Yes, sure. Thank you. Doctor, what is miscarriage? Basically, we are here to discuss about recurrent miscarriage. If you can brief us about what is miscarriage?
So, miscarriage is pregnancy loss before 24 weeks of pregnancy. If the pregnancy loss is in the first 3 months of pregnancy, then it is known as first trimester miscarriage or early miscarriage.
Okay, okay. Then what is recurrent miscarriage?
Recurrent miscarriages is when there are 2 or more pregnancy loss in a woman.
Okay. So, what is likelihood of having this recurrent miscarriages?
A recurrent miscarriage affects fewer than 5 in 100 women.
Okay,
Yes.
okay. So, what is the most common cause for this miscarriages?
The most common cause of miscarriages, like in about uh, in every miscarriage, in about half of the miscarriages which usually happen in women, the most common cause is a genetic abnormality. That is, any chromosomal abnormalities in the embryo. That is, when an embryo receives abnormal number of chromosomes during fertilization, most of the times it happens by chance. It is not associated with any medical condition, and even the parents will have normal chromosomes.
Okay, okay. Why does this recurrent miscarriages happen?
Okay, there are many factors which causes recurrent miscarriages more likely. One would be the age of the mother. As the mother grows older, the chances of having a recurrent miscarriage that increases. If a woman is less than 25 years of age, then the risk of miscarriage is less than 15%. That is, 15 in 100 women will have miscarriage. But if the age is beyond 35 years, that is, if a woman is between 35 to 39, the chance of miscarriage is 25%. And if she is between 40 to 44 years, it would be around 51%. And if she is more than 45 years, then it would be around 91% miscarriage. And
Okay.
it also depends on the age of the father. That is, if the age of the father is more than 40 years of age, then the chance of miscarriage also increases, because the quality of the egg declines as the mother's age increases.
Oh, well.
Yes.
Does lifestyle affect recurrent miscarriage rates?
Yes, they do. Having, if there is excessive weight, like overweight, that is body mass index more than 25, or underweight, that is body mass index less than 19, or cigarette smoking, drinking alcohol in excess, drinking caffeine in excess, can are linked with miscarriage rates.
Doctor, how common are this explained repeated miscarriages, and what are the chances of having successful pregnancy in such cases?
So, unexplained miscarriages are quite common.
Okay.
In almost more than half of the cases, it is in almost half of the cases, uh, we cannot find any cause. In such cases, the current evidence says that any form of medical treatment will not help in reducing the miscarriages. So, the chance of having a successful pregnancy in such cases is quite good. About 6 in 10 women will go on to have a successful pregnancy in cases of unexplained recurrent miscarriages.
Okay, okay. And now, can you explain about what tests and exams are available to help this recurrent miscarriage?
So, first of all, a thorough physical examination along with pelvic examination is required in order to find any abnormality in in the woman. Then, second would be some blood tests in order to rule out thyroid problem, in order to rule out any abnormal blood glucose, and also in order to rule out certain blood clotting factors like antiphospholipid syndrome. So basically, in antiphospholipid syndrome, the Basically, I think before this, we should discuss what are the causes of recurrent miscarriages, which we have not discussed yet. So basically, the causes of recurrent miscarriages are one would be the age, which I have discussed. The second one would be any genetic condition. If one of the parent has any abnormal arrangement of the chromosomes, then the parent may not have any physical signs or symptoms, but if it is passed on to the embryo, and if the embryo has too much excess genetic material or less genetic material, then it can lead to miscarriage. That is one factor. The other factor would be any blood clotting disorders like antiphospholipid antibody syndrome. In such cases, there is issues with the blood clot, and apart from recurrent miscarriages, the woman can also have other complications during the pregnancy, during the last part of the pregnancy, like she can have uh, high blood pressure or fetal growth restriction, that is, the growth of the baby will be restricted, and also sudden fetal demise inside the uterus, and the woman may have tendency to get blood clots elsewhere, like in the legs, in the lungs.
Okay.
So that is one condition which can lead to recurrent miscarriage. The other conditions would be any conditions in the uterus, like if there is any abnormalities in the uterus in the form of septate uterus. Septate uterus is the most common abnormality which is linked with recurrent miscarriage. So in that case, septate uterus is basically the presence of a thin wall of tissue inside the cavity of the uterus, and thus it divides the cavity of the uterus into two halves. So in such cases, what happens, the embryo doesn't get implanted, and even if it gets implanted, it does not stay there. So that is the most common. The other abnormalities can be like a fibroid uterus or polyp inside the uterus. They are basically extra growth of the uterus. Or there can be, if the cervix of the uterus is weak, if it is weak, then it will not be able to hold the pregnancy, and thus there will be late miscarriages that will happen after 14 weeks, or in cases of scarring inside the uterus. So when there is scarring inside the uterus, obviously the embryo will not get implanted, or the embryo will not stay there. Okay, so these are certain uterine causes which can lead to miscarriages. Apart from that, there can be certain hormonal problems as well. So the hormonal problems would be like if the woman has diabetes. Well-controlled diabetes does not increase the risk of miscarriage, but if it is uncontrolled, it will increase the risk of miscarriage. Second hormonal problem would be thyroid. The presence of thyroid antibodies, or if the thyroid is not, thyroxine level produced in the body is not adequate, that can lead to miscarriage. But again, if it is a well-controlled thyroid disease, it will not increase the chance of miscarriage. The next would be PCOS. In women having PCOS, they are more prone for miscarriage. The exact cause is not clear, but could be due to excessive testosterone and insulin hormones in these women. The other cause would be excessive prolactin hormone, which is also linked with miscarriage. The last one is the vitamin D deficiency. If vitamin D deficiency is present in a woman, that can also lead to miscarriage. So these are few causes which can lead to recurrent miscarriages, and if we investigate accordingly to find the cause, then we can treat the cause of the miscarriage, and thus try to have a successful pregnancy in the woman.
Okay. So if you are telling this treatment, so what's the treatment options we have?
So the first we will investigate, like I have already told, we'll have to do an examination, thorough examination, and also some blood tests to rule out diabetes, to rule out thyroid disease, also to rule out the antiphospholipid, which I already mentioned. So antiphospholipid syndrome is actually confirmed by having two positive results by doing a blood test 12 weeks apart, and it should be done at least 6 weeks after a miscarriage. So if it comes as positive, then we will treat that accordingly. I will be talking about the treatment in some time. The other tests which should be done would be a pelvic ultrasound in order to have a look at the uterus, if there is any abnormality of the uterus. So in case there is any suspicion in the scan, we may offer extra investigations like a 3D ultrasound or a MRI pelvis or a hysteroscopy in order to look into the cavity of the uterus. The other tests would be a genetic testing. In genetic testing, first we would do a genetic testing of the pregnancy tissue at the time of miscarriage. In case there is any abnormality in that, then we may also offer a genetic testing for the parents to look for any genetic abnormality in them. So these are few investigations. So coming to the treatment part, first is a lifestyle. They have to maintain a normal weight. In case they are overweight, then they have to lose weight. If they are underweight, they have to gain weight and bring it to the normal body mass index. The second is to stop smoking, to avoid alcohol or to avoid taking alcohol in excess, to limit caffeine intake to less than 200 milligram per day.
Exactly.
So that is one lifestyle. Next is, depending on what investigations came out to be positive. If it is antiphospholipid antibody syndrome, then we taking low dose aspirin tablets before conception and starting with blood thinning injections, that is heparin, at the on from the day of positive pregnancy test will help in reducing the miscarriage rate and having a successful pregnancy. If a genetic abnormality has been found during investigation, then in that case, we would offer a genetic counseling for the couple in order to ascertain what is the risk of having the miscarriage due to genetic abnormality in the future pregnancies. And then if there is a high risk, then there are certain treatment options available like IVF with PGT, that is pre-implantation genetic testing. In that case, what we do is after the embryo is formed, the embryo will be tested for any genetic abnormality and only unaffected embryos will be used in the IVF for the pregnancy. Or if a woman has any genetic abnormality, then IVF with a donor egg can also be considered. Or if the male partner has a genetic abnormality, then IUI with a donor sperm, donor semen can be considered. So that is about the genetic abnormality. In case the investigation shows any abnormality in the uterus, then we have to do some corrective surgeries. Like for the septate uterus, we have to remove the septum. In case of fibroid or polyp, we have to remove them. And in cases of scarring of the uterus, which we call it as Asherman syndrome, we'll have to do some surgeries to remove the scars and then put them on some hormone treatment so that the scar doesn't come back. And in case of a weak cervix, we put a stitch at the cervix around 14 weeks of pregnancy so that the stitch holds the cervix, stays in place and it doesn't open up till the end of the pregnancy. So this is with respect to the uterine abnormality. And in case of any hormonal problems, which we already discussed, if that is diagnosed in case of uncontrolled diabetes, we'll have to treat that. In case of uncontrolled thyroid disease, we'll have to treat that. And if a patient has vitamin D deficiency, we'll have to give vitamin D supplements. So these are some treatment options for recurrent miscarriage.
Okay, this must be a mental effect for.
Yes.
So that if you can tell me, how does this recurrent miscarriage affects the mental health?
Yes. Recurrent miscarriage has a major emotional effect on the patients and on the parents as well as the family. So feeling of loss, grief, and the sense of failure is quite normal in such cases. And for women, especially for women who have had recurrent miscarriages, it is important for them to know that miscarriages mostly are never caused by anything you did or you did not do. And if you are having trouble with managing with your emotions, then talk to your healthcare professional, your OB-GYN or therapist. That would help, because physical recovery will take few couple of days, only a couple of days, but then emotional recovery may take some time. The grieving process may take some time. So
True.
And also discuss with your gynecologist when is the best time to have to plan for your next pregnancy. And it is also a good idea to be healthy before planning for your next pregnancy, to go for a pre-pregnancy checkup, to take folic acid tablets before pregnancy, and also to have a healthy diet and to exercise daily at least for 30 days, 30 minutes in a day. Thank you.
Very informative. Thank you so much for this. With this, we can come to an end of today's live show. Thank you, doctor. Thank you for your valuable insight. So, thank you, viewers, for joining us. If you have any queries, you can leave us the comment, and our experts will answer to your questions. And thank you so much for watching.